Every day, BMC faces challenges. Storm after storm, setback after setback. Our desire to become better does not waver. Since 1933, our name was changed 3 times. Our hospital beds increased from 25 to 1,000. Our mission evolved to provide multidisciplinary healthcare services, training, and research for healthier and more resilient Bicolanos. This is the big why for BMC to adopt the Performance Governance System, or PGS. Months after the PGS initiation of BMC, the World Health Organization declared COVID-19 a pandemic. BMC immediately prepared for the crisis and has since become one of the COVID-19 referral centers in the country, the biggest in the Bicol region. Zoning was implemented to separate the COVID-19 emergency room, ICU, and wards from the main hospital. Doing this enabled BMC to continue its function as a tertiary and referral medical center. BMC prioritized the need to establish the Emerging and Re-emerging Infectious Disease, or ERID Specialty Center. This is the first strategy recalibration of BMC.
That is a PGS, so meron kaming sinusundan na goal. No? Hindi yung parang bara-bara lang.
Last January, the Department of Health, through its Department Order No. 2021-0001, charged BMC to establish additional specialty centers. This commissioned BMC to have the second strategy recalibration, resulting in the BMC PGS Strategy Map 2025. As a Level 3 authorized 1,000-bed hospital, by 2025, BMC will have 9 established basic comprehensive specialty centers and 5 advanced comprehensive specialty centers. With the PGS, BMC is on track. Our existing linkages were further strengthened and formalized through the formation of the BMC Multisectoral Governance Council.
And with the multisectoral group, ma-relay sa Bicol Medical Center kung ano talaga yung need. Kung ano naman yung plans, activities, direction ng Bicol Medical Center can be forwarded to the multisectoral group.
The success of the PGS in BMC depends upon the understanding and commitment of every personnel. We are making sure that every hospital staff member can identify where their role is in the strategy map. Each personnel's daily work should be anchored and aligned. Through PGS, BMC will surely become a transformed, patient-centered, highly specialized tertiary medical center with multiple specialty services in the Bicol region. This is now your Bicol Medical Center.
When Bicol Medical Center received the Gold Trailblazer Award for the PGS Initiation Status on November 28, 2019, we seized the start of bigger responsibilities. Encouraged to keep moving forward, we optimize our efforts towards making good governance in the public sector a way of life. Patient care remains our utmost priority, and no crisis can ever stop us from doing our mission, not even a pandemic. The Universal Healthcare Law became our driving force to surge through and achieve bigger things for our clients. From our hospitals' overwhelming congested clinical wards, which we mentioned in our initiation, our patients are now admitted in spacious and well-ventilated rooms. Timely for the pandemic, we were able to open the 6 floors of the 8-story General Wards building, the 5-story emergency room, modernized psychiatric buildings, cancer center, and some specialty centers, and making it operational. The additional 360 beds for the different clinical areas significantly reduced our bed occupancy rate from 176% in 2018 to 88% covering January to June this year. Through the help of concerned lawmakers, in July of 2020, President Rodrigo Roa Duterte signed into law the Republic Act 11478, increasing our bed capacity to 1,000, a silver lining amidst the health crisis. We optimize our established external partnership through our linkages roadmaps and effectively coordinated with municipal, city, and provincial health officers of the Bicol region. We help capacitate healthcare workers on managing persons with COVID-19. We also conducted online coaching and mentoring to municipal and provincial health officers on mental health gap action program. Our IHOMP unit designed an online ER referral system of pilot RHUs and hospitals, which is available 24/7, both an innovation and preventive response. Our regional cancer center, which has served 7,874 patients this year, launched the online appointment system, which brought about significant relief, convenience, less waiting time, and exposure to COVID-19. Other innovations of the iHome that improve service delivery include electronic customer satisfaction survey, human resource information system, digitalized patient chart, and PhilHealth automation program, among others. We bank on using a multifaceted approach, interconnecting linkages, information, and communication technology for our patient care, specifically with our COVID-19 response. We have prepared our facility to be our referral center even before the first confirmed COVID-19 case reached BMC. We prioritized the Arid Center that was initially targeted in 2028, which we see now as providential. Now we are receiving referrals both from the private and government healthcare facilities of Camarines Sur and nearby provinces. To mention other accomplishments, the Poison Control Center is now fully functional with 24/7 hotline access by the community. Our Cardiac Center is now fully equipped, awaiting FDA approval to become fully operational. In fact, our catheterization laboratory has just performed its first case of coronary angiogram. The Orthopedic Center, which is targeted for 2022, is now fully operational. Its residency accreditation is scheduled for next month. The Trauma and Burn Center has dedicated operating rooms and 5 ICU beds at the ICU complex. Our Brain and Spine Center aims to become a basic comprehensive specialty center in 2025 in response to the increasing cases of cerebrovascular disease. Last February 1, 2021, our neurosurgeon, Dr. Elmer Meseda, and his team successfully performed in our hospital the world's first sleep disc surgery through the mouth, which is considered a medical breakthrough. For our strategy review, covering January to June this year, we achieved 47% of our targeted strategic contributions for our specialty centers despite the health crisis, while 21% are still in progress and 32% have been recalibrated for later years due to the pandemic. We have proven that strategy execution is a shared responsibility. BMC has over 2,100 employees, so we use the clustering method of cascading to link the executive committee down to the rank and file. To ensure commitment to the PGS, new and existing employees identified their significant role and contribution in the strategy map. For standard messaging, our OSM and the communications team produced a 13-minute documentary video of the BMC PGS Recalibrated Strategy Map 2025, which we presented in the online and face-to-face cascading activities. Led by our training unit, we also organized a series of focus group discussions to check every BMC employee's understanding of our PGS journey. Quarterly, our OSM conducts spot audits to gauge performance, especially the specialty center and the department's staff. We harmonize PGS with our existing ISO certified quality management system, and to further integrate the strategy implementation, the contribution of each unit were also harmonized in both the office and individual level of their strategic performance management system. We encourage governance, sharing of the different divisions with a multidisciplinary approach to process improvement. Through our praise committee, we continue to recognize those who have achieved excellence in our PGS, including personnel, units, and sections with exemplary performance during our quarterly strategy management reviews. Our seamless strategy implementation We link PGS to our performance budget with a 63% allocation for capital outlay for 2021. To ensure the sustainability of resources and improve revenue generation, we will promote the efforts of the Revenue Enhancement Committee. Immediately after our initiation, we integrated the Office for Strategy Management into our organizational structure and is directly under the MCC office. It is composed of technical support and the PGS Core Team, all holding a permanent position. The team works hand in hand to ensure continuous strategy implementation by way of monitoring, facilitate strategy reviews, and provide feedback on the status of performance indicators. Our existing partnership with key external stakeholders were further strengthened as we formalized the creation of the BMC Multi-Sector Governance Council, where they pledged to proactively assist BMC in realizing its strategic directions. They were selected based on their community involvement and commitment, as well as their linkages with the community and other stakeholders. As proof of their commitment, the provincial government of Camarines Sur recently lent 15 mechanical ventilators for our COVID ward as their assistance in the COVID-19 surge in the region. The Rotary Club of Naga has been a consistent donor of medical equipment even before the pandemic and has pledged to help more in the coming years. The Philippine Information Agency Camarines Sur chapter helps the hospital's information dissemination and health campaigns through published news and articles to the local and national press. Our best practices are shared through a series of documentaries or stories posted on the BMC official Facebook page and website and employees' Facebook group. Some of our successful innovations, specifically iHome, are being benchmarked by other agencies like Camarines Sur Civil Service Commission and DOH Bicol. However, it is also a golden opportunity to learn from others, particularly as a committed stakeholder in the Army 9th Infantry Division Multi-Sectoral Advisory Board, where our OSM head, Dr. Edgardo Paredes, represents BMC. Moving forward, we commit to do the following. First, we shall reinforce the succession planning of our key leaders, as some of us, including myself, will be retiring this year. Second, we shall also expedite the recruitment, selection, and placement of the additional 963 plantilla positions for the 1,000-bed hospital to augment our needed human resources complement. Third, we will step our performance accountability by having a quarterly scorecard presentation and a monthly exhibition featuring the PGS roadmaps and scorecards by cluster to sustain the improvements towards proficiency. Fourth, we shall expand our healthcare delivery network through formal linkages with district hospitals in nearby provinces as far as Quezon Province, like the Maria Eliasar General Hospital, to help improve their patient care delivery system, and to sustain the commitment of our MSGC and partner stakeholders. We are ready to provide any medical and healthcare assistance. Fifth, we shall incorporate personal governance in every employee's individual performance commitment review, as we cannot govern others if we cannot govern ourselves. Finally, we will pursue and realize our vision of establishing our advanced and basic comprehensive specialty centers, complete with the infrastructures and equipment requirements. As our driving force for a unified vision to achieve our next stage on our PGS journey, we launched the new BMC tagline, #For Better Medical Care, in line with the DOH vision that Filipinos are among the healthiest people in Asia. Ito rin po ang ambag ng BMC para matupad ang ambisyon 2040 para sa matatag, maginhawa at panatag na buhay sa minamahal nating bansang Pilipinas. Diyos mabalos po.
Welcome back, panelists and attendees. I know that by this time you are all extremely eager and curious to know about the results. Let us not prolong it any longer. I would now like to call on our panel chair, Mr. Bill Luz, to tell us how the Bicol Medical Center has fared thus far on this governance pathway.
Thank you very much, and good morning once again, ladies and gentlemen. After careful deliberation, the panel has decided that the Bicol Medical Center, which aims to position itself as a tertiary hospital with a 1,000-bed capacity, offering 9 basic comprehensive and 5 advanced comprehensive specialty centers by 2025, shall be conferred with the PGS compliant status. We are pleased to announce that the Bicol Medical Center is a Gold Trailblazer awardee. Congratulations, Dr. Salas and team.
Congratulations.
Congratulations, Dr. Salas. Congratulations to Bicol Medical Center.
Thank you very much po. Thank you very much.
Congratulations to Pico and to the BMC family.
Thank you very much po. Asek, thank you very much. Diyos mabalos po.
Once again, congratulations, Dr. Salas, and of course, the Bicol Medical Center. Please note that we shall send an email certifying your advancement in the PGS. Now, may we please call on once again Dr. Salas for his acceptance speech.
Thank you very much po. Diyos mabalos in Bicol, we say Diyos mabalos po. At the moment, I'm thinking what I'm going to say, but siyempre, papasalamat muna kami kina for helping us go through this. Once again, good morning to all of you. I am deeply honored and grateful to receive this Gold Trailblazer Award. As we bid today for the compliant status in the performance governance system. And also, I would like to thank in advance your group for your time. Alam ko, busy po kayo. Si Dr. Di Macali, si Asek, si Dr. Bok, tapos si Dr. Rami. Understanding the PGS as a framework to design and execute roadmap towards governance reform, it also means translating our vision to actionable strategies and commitments, leading to breakthrough results. And these breakthroughs will make government agencies like Bicol Medical Center more sustainable and responsive to its purpose. Today, I presented the transformation story, journey, and aspirations of Bicol Medical Center to become a patient-centered, highly specialized tertiary medical center in Bicol. This achievement is a testimony of the cooperation of our employees as well as their individual efforts, but most especially of the Office of the Strategy Management headed by Dr. Gary Paredes' significant role in ensuring the continuous strategy implementation and accomplishment of deliverables. I wish to thank the people behind this good governance advocacy, the Institute for Solidarity in Asia. Without your dedication and mission to empower public institutions and your support through mentorship and coaching, institutional reforms, engagement with internal and external stakeholders, the MSGC, and better public service would not have been possible. I also recognize the struggles and challenges the entire BMC community had to face, especially that we are still in the middle of a global health crisis. Indeed, this was not an easy task to handle. But then, as we go through this transformational journey, we realize how rewarding it turns out to be. This is not because of you or because of me. It's always a we. Our team efforts, our commitment to improve our services and be responsive to the needs of our clients, that we are now reaping the fruit of our hard work. Congratulations to all of us and thank you very much, ISA. God bless po. Mabuhay kita kabos.
Thank you so much, Dr. Salas. And once again, congratulations to the Bicol Medical Center for your conferral of the PGS compliance status. Before we all go, may we please request our panelists and employees from BMC to turn on their cameras. We shall have our Revalida photo to commemorate this truly exciting milestone. All right, let's take a photo in 3, 2, 1. All right. Thank you so much, everyone, and to our dear panelists for joining us today. And that concludes the online Revalida of the Bicol Medical Center. Their story shall serve as a symbol of transformative power of good governance that will pave the way to achieving quality healthcare in the country.